Right now, while you are reading this, your blood contains more sugar than it should. And here is what nobody has explained to you clearly. The medications most diabetics take every day do not remove that sugar from your body. They redistribute it. They move it from one place to another. They hide it. But the excess glucose remains inside you, silently attaching to your nerves, stiffening your arteries, clouding the vessels in your eyes, and accumulating year after year while your doctor tells you that your numbers are controlled. Controlled is not the same as eliminated. Your kidneys were designed with an emergency elimination system, a biological mechanism that can pull glucose directly out of your bloodstream and expel it through urine. This system exists in every diabetic. It is not broken. It is not disabled by age. It is simply not being activated. And there is a specific combination of 3 plants taken as a warm drink 30 minutes before bed that sends the precise molecular signal to activate it while you sleep. I'm Dr. Jake Taylor, and today I'm going to explain the science behind why your current treatment manages your blood sugar without ever removing it, how your kidney's natural glucose elimination system works and why it has been switched off, and the exact nighttime protocol with precise ingredients, proportions, preparation method, and timing that activates it. This is not a miracle claim. This is biology. Specifically, it is the biology of SGLT2 transporters, the same mechanism that pharmaceutical companies spent billions developing drugs to replicate. The natural version costs almost nothing and has no dangerous side effects. Write your country in the comments. And if you're new here, subscribe and turn on notifications. I make these videos every week for people managing diabetes who want to understand what is actually happening in their body. Let me tell you about Frank. He was 71 and had been managing type 2 diabetes for 9 years. He was taking metformin, a sulfonylurea, and had recently been told that insulin was likely the next step. His fasting glucose rarely dropped below 175. He was waking with numb hands. He had tingling in his feet most evenings. He came to me not because he had given up on his medications, but because he wanted to understand why, after 9 years of taking them faithfully, things kept getting worse. When I explained the distinction between glucose redistribution and glucose elimination, something shifted in his expression. "Nobody has ever explained it that way," he said. "I assumed controlled meant it was gone." It was not gone. It was still there, accumulating, causing damage year after year despite compliant medication use. We added the nighttime protocol to his existing treatment. I want to be clear. We added it. We did not replace anything without medical supervision. Within 7 nights, his fasting glucose had dropped by 28 points. Within 3 weeks, his morning numbness had decreased noticeably. Within 6 weeks, his physician had reduced one of his medications for the first time in 4 years. "I wish someone had explained this 9 years ago," he said. "Today, I'm going to explain it to you now." Before we go further, I want you to understand something about the approach in this video. I am not telling you to stop your medications. I am not telling you that pharmaceuticals are the enemy. What I am telling you is that there is a biological mechanism your current treatment is not using, and that activating it alongside your existing treatment produces results that neither approach achieves alone. This is not alternative medicine versus conventional medicine. This is understanding your body's full toolkit and using all of it. Why your medication manages blood sugar but never removes it. Before we get to the protocol, you need to understand something that most diabetics are never told clearly, because once you understand it, everything else in this video will make complete sense. The most common diabetes medications work through one of 3 mechanisms. Metformin reduces the amount of glucose your liver produces and releases into the bloodstream. Sulfonylureas stimulate your pancreas to produce more insulin. DPP-4 inhibitors prolong the activity of hormones that stimulate insulin release. Notice what all 3 approaches share. They manage the glucose that is already in your system by moving it, suppressing it, or stimulating a hormonal response to it. None of them remove glucose from your body, not 1 milligram. Think of it like a warehouse that is being filled with boxes every day. Metformin slows the delivery truck slightly. Sulfonylureas hire more workers to stack the boxes more efficiently. DPP-4 inhibitors improve the organization system, but at the end of every day, the warehouse has more boxes than it did the year before. The boxes are just arranged more neatly. This is why most long-term diabetics experience what their doctors describe as progression, not because the medications have failed, but because managing a flood is not the same as draining it. And the warehouse keeps filling up. I want to be precise about this because it matters for how you understand your own situation. If your A1C is 7.2 and your doctor says you are controlled, what that means is that your average blood glucose over 3 months is approximately 160 milligrams per deciliter, which means that for most of every day, your blood contains significantly more glucose than it should. The cells in your retina are sitting in that glucose. The nerve fibers in your feet are sitting in that glucose. The filtration units in your kidneys are sitting in that glucose. Controlled means the level has been brought to a range that is less immediately dangerous. It does not mean the damage has stopped. It does not mean the glucose is gone. There is a different approach, one that actually removes glucose from the body. It does not redirect it or suppress it. It opens a drain. Your kidneys filter your blood continuously, approximately 180 liters per day. Under normal circumstances, when they detect glucose in the filtered fluid, specialized proteins called SGLT2 transporters capture that glucose and return it to the bloodstream. The kidneys were designed to conserve glucose because, historically, glucose was scarce and survival depended on retaining every available calorie. But you are not living in a period of scarcity. Your bloodstream is chronically saturated with glucose. And those SGLT2 transporters keep reabsorbing it, returning it to a bloodstream that already has too much, because they are following an ancient survival program that has not been updated for the modern metabolic environment. What would happen if you could signal those transporters to stand down, to stop reabsorbing, to let the glucose pass through into the urine and out of the body permanently? That is exactly what SGLT2 inhibitor medications do. Canagliflozin, dapagliflozin, empagliflozin. These are the drug names. They block the SGLT2 transporters and force the kidneys to expel glucose through urine. They cost hundreds of dollars per month and carry risk profiles that require careful medical monitoring. And that is what the 3-plant nighttime protocol does naturally, through plant compounds called glucosides that send the same molecular signal to the same transporters at a fraction of the cost and with a safety profile your body recognizes as food rather than pharmaceutical. The pharmaceutical industry did not discover this mechanism. They studied plants that indigenous communities had been using for centuries, isolated the active mechanism, and synthesized a drug version of it. The original mechanism exists in nature. That is what tonight's protocol uses. There is one more piece of this picture that almost nobody explains. When SGLT2 inhibitor drugs were first studied, researchers noticed something unexpected. Patients taking them lost weight without trying, their blood pressure improved, and their cardiovascular risk markers dropped, none of which were the intended effects. These benefits occurred because reducing the glucose burden in the bloodstream reduced inflammation throughout the entire vascular system. The same downstream benefits occur with the natural version of this mechanism. Glucose elimination is not just about the number on your glucose meter. It is about everything that elevated glucose was silently damaging while it circulated. Why nighttime is the only time this works. The timing is not arbitrary. It is based on the biological rhythm of kidney function. Your kidneys do not work at a constant rate throughout the day. Their filtration capacity follows a circadian cycle. Between 2 and 6 in the morning, renal filtration reaches its peak. This is when your body performs its deepest biological cleaning. Metabolic waste products, toxins, and cellular debris are expelled most efficiently during this window. If you take the protocol 30 to 45 minutes before bed, the active compounds reach your kidneys precisely as this cleaning cycle begins. The SGLT2 transporters receive the signal to stand down. The kidneys are at their maximum filtration capacity. The glucose that has been accumulating in your bloodstream begins moving toward the renal tubules, into the bladder, and out of the body. You will notice this is working because you will wake 1, 2, or possibly 3 times during the first nights with a strong urge to urinate. The urine volume will be larger than normal. Do not be alarmed. This is the glucose leaving. This is the drain opening. By the third night, your body adapts to the pattern. The nighttime interruptions decrease, but the elimination continues. Your kidneys have relearned a function they were always capable of performing. There is a second reason nighttime specifically matters for blood sugar. Your liver produces and releases glucose into the bloodstream throughout the night, a process called hepatic glucose output, which is responsible for the elevated fasting readings many diabetics experience even after a night of not eating. The second plant in this protocol directly addresses hepatic glucose output by sensitizing insulin receptors in the liver cells, reducing the amount of glucose your liver releases overnight. These two mechanisms working simultaneously, increased renal glucose elimination and reduced hepatic glucose output, produce fasting readings that most diabetics have not seen in years. The three-plant protocol: ingredients, science, and preparation. Now, I will tell you exactly what goes into this drink, why each ingredient is essential, and precisely how to prepare it. The preparation method matters as much as the ingredients, because certain compounds are destroyed by boiling while others require heat to be released. Getting this wrong reduces the effectiveness significantly. Plant number 1, Moringa. Moringa oleifera is the primary active ingredient and the one responsible for the SGLT2 signaling effect. Moringa contains specific glucosinolates and quercetin glycosides that interact directly with the SGLT2 transporters in the renal tubules. When these compounds reach the kidney filtration membranes, they reduce transporter activity, allowing glucose to pass into the urine rather than being reabsorbed. Research published in peer-reviewed journals has documented Moringa's effect on blood glucose in both animal models and human subjects. A study found that consistent Moringa consumption produced significant reductions in fasting blood glucose over 4 weeks compared to control groups. The mechanism aligns precisely with what indigenous communities in India had observed for generations before the science caught up to explain it. Moringa is available as dried leaves in most health food stores, online retailers, and international grocery stores. Use 2 tablespoons of dried leaves per serving. If you can find fresh moringa leaves, use 4 tablespoons because fresh leaves contain more water by weight. Plant number 2, Ceylon cinnamon. Not all cinnamon is equal, and this distinction is critical. The cinnamon sold in most supermarkets is cassia cinnamon. It contains significant amounts of coumarin, a compound that in regular doses can stress the liver. Ceylon cinnamon, also called true cinnamon, contains minimal coumarin and maximum concentrations of cinnamaldehyde, which is the compound responsible for its therapeutic effect on blood sugar. Cinnamaldehyde mimics insulin at the cellular receptor level. It binds to insulin receptors on muscle cells and signals them to uptake glucose from the bloodstream. This is insulin sensitization without stressing the pancreas, without depleting beta cells, and without pharmaceutical side effects. It reduces the amount of new glucose accumulating in the blood overnight, while Moringa is clearing the existing glucose through the kidneys. Together, they address the problem from 2 directions simultaneously. Use 1 Ceylon cinnamon stick of approximately 7 centimeters, or 1 teaspoon of Ceylon cinnamon powder if you cannot find the stick. Look for the label that specifically says Ceylon cinnamon or Cinnamomum verum. If the label says cinnamon without specification, it is almost certainly cassia. Plant number 3, turmeric. Turmeric contains curcumin, which serves as the protective and anti-inflammatory component of this protocol. Curcumin does something specific to diabetes that neither moringa nor cinnamon addresses. It inhibits a process called advanced glycation. When glucose circulates in the bloodstream at chronically elevated levels, it attaches to proteins throughout the body. This attachment process is called glycation, and the structures it creates, called advanced glycation end products or AGEs, are responsible for many of the long-term complications of diabetes. Hardened arteries from glycated collagen, nerve damage from glycated myelin sheaths, kidney damage from glycated filtration membranes, retinal damage from glycated blood vessels in the eye, Curcumin blocks the formation of these structures, while Moringa and Ceylon cinnamon are working to reduce the glucose load in your blood. Turmeric is simultaneously repairing the vascular damage that excess glucose has already caused. It is the structural repair component of the protocol. Use half a teaspoon of turmeric powder. Always add a small pinch of black pepper to the preparation. The compound in black pepper called piperine increases curcumin absorption by up to 2,000%. Without black pepper, the majority of the curcumin passes through unabsorbed. This is not optional. Black pepper is essential to the effectiveness of the turmeric. How to prepare it correctly? Bring 500 milliliters of water to a boil. When the first bubbles appear, reduce the heat to medium. Add the Ceylon cinnamon stick or powder and allow it to simmer gently for 5 minutes. This temperature and duration releases cinnamaldehyde without evaporating it. After 5 minutes, turn the heat completely off. Add the moringa leaves and turmeric powder immediately. Add the pinch of black pepper. Cover the pot and allow it to steep for exactly 10 minutes. Do not let the moringa boil. High heat destroys the glucosinolates that make it effective. The residual heat from the just boiled water is sufficient to extract the compounds without damaging them. After 10 minutes, strain the liquid. You will have approximately 400 milliliters of a dark amber liquid with an earthy, spiced aroma. Add the juice of half a lemon immediately before drinking. Citric acid enhances curcumin absorption, and the slight acidity complements the other compounds beneficially. Drink it at body temperature, approximately 35 to 40 degrees Celsius, not hot, not cold. Warm liquid is absorbed most efficiently in the small intestine, which means the active compounds reach your bloodstream in 25 to 30 minutes, precisely when you lie down to sleep. Take this drink 30 to 45 minutes before your normal bedtime. Not earlier, not later. Earlier means the compounds peak before the kidney's deep cleaning cycle begins. Later means you will be disrupting sleep at its earliest and most restorative stage. If you typically sleep at 10 p.m., take the drink at 9:15 or 9:30. Do not add sugar, honey, or artificial sweeteners during the first 7 days. Allow your glucose receptors to recalibrate without competing sweet signals. What happens each night? The 7-night timeline. Nights 1 and 2. Activation phase. Your body is recognizing molecular signals it has not received in years. The SGLT2 transporters are beginning to respond. You will urinate 2 to 4 times during the night. Volume will be higher than normal. You may experience mild thirst when you wake. Drink water when you get up. Your fasting glucose the following mornings may show a modest reduction of 5 to 10 points. The significant changes are happening at the cellular level, where you cannot yet see them. Do not evaluate effectiveness based on these first 2 mornings. Nights 3 and 4, deep cleaning phase. The transporters are now responding fully. Hepatic glucose output is beginning to decrease as the cinnamon's insulin sensitizing effect accumulates. Your fasting glucose should show a reduction of 15 to 25 points from your starting point. If you began at 165, expect to see readings near 140 to 150. The nighttime urination frequency decreases slightly. Morning energy improves noticeably. The mental fog that many diabetics experience upon waking, caused by overnight glucose fluctuations, begins to lift. Dorothy was 69 and described her mornings as feeling like waking up through water. By night 4 of this protocol, she described the difference as waking up feeling like herself for the first time in years. Her fasting reading that morning was 138. It had been 171 when she started. Nights 5, 6, and 7. Stabilization phase. Your metabolism is consolidating the new pattern. Insulin receptors are functioning more efficiently. The kidneys have memorized the elimination rhythm. Fasting glucose should be 20 to 40 points below your starting measurement. Foot tingling and hand numbness, if present, typically decrease noticeably by this phase. Ankle swelling reduces. Skin tone improves as glycation decreases and tissue oxygenation improves. At the end of 7 nights, you will have measurable evidence, your own fasting numbers, that this system is working. That is your data. That is your proof. One thing I want to address directly because I hear it consistently from patients. Some people experience no nighttime urination at all during the first 2 nights and conclude the protocol is not working. This occasionally happens when the starting glucose is lower, typically below 130, because there is less excess glucose available to be expelled. In these cases, the mechanism is still activating, but the quantity being eliminated per night is smaller. The signal to watch in these cases is the fasting number, not the urination frequency. If your fasting glucose is declining day by day, the protocol is working regardless of how many times you get up at night. Conversely, some people experience significant nighttime urination from the very first night. This is more common when starting fasting glucose is above 160. Both responses are normal. Both indicate the system is functioning. The biology varies between individuals. Trust the numbers on your meter, not expectations about what the experience should feel like. Critical medical warnings. These warnings are not optional reading. They are essential. If you are currently taking diabetes medications, do not stop them without your physician's supervision. This protocol will amplify the glucose-lowering effect of your existing medications. Your fasting glucose will drop more than it would from medication alone. If it drops below 90 milligrams per deciliter, contact your physician to discuss medication adjustment. Do not stop the protocol. Discuss reducing the medication with your doctor. If you have active kidney stones or advanced chronic kidney disease, consult your physician before starting. Moringa has a diuretic effect that can mobilize small stones. If you are pregnant or breastfeeding, this protocol is not appropriate. Moringa in therapeutic doses has documented effects on uterine tissue. Monitor your fasting glucose every morning and record it, date and number only. This record will be essential for any conversation with your physician about adjusting your medications as your glucose improves. Your 30-day commitment and how to start tonight. Here is what I want you to do with the information in this video. Today, find the 3 ingredients: Moringa dried leaves, Ceylon cinnamon, and turmeric powder with black pepper. Health food stores carry all 3. International markets often carry Moringa at lower cost. Online retailers ship all 3 within days. The combined cost for a month's supply is typically between $8 and $15. Tonight, prepare your first batch exactly as I described. Follow the preparation sequence. Cinnamon first with gentle heat for 5 minutes. Heat off. Moringa and turmeric added to steep for 10 minutes. Strain, add lemon, drink warm 30 to 45 minutes before bed. Tomorrow morning, record your fasting glucose. That is your day 1 number, your baseline. Every morning for 7 days, record that number and watch it move. The 7 things to eliminate during these 7 days are white flour products, refined sugar, white rice, commercial fruit juices, processed vegetable oils, alcohol, and ultra-processed snacks. These are not permanent deprivations. They are 7 days of removing the inputs that keep refilling the warehouse while you are trying to open the drain. The 5 things to eat more of during these 7 days are avocado, raw almonds, broccoli, fatty fish, and blueberries. Each of these supports insulin sensitivity, reduces inflammation, or directly supports the mechanisms this protocol is activating. Margaret was 72 and had been told her diabetes was progressive and irreversible. She had accepted this. She followed the 7-night protocol with the dietary adjustments. On day 7, her fasting reading was 119. It had been 168 when she started. Her physician, at her next appointment, reduced her sulfonylurea dose for the first time in 6 years. "I thought controlled was as good as it got," she said. "I didn't know that eliminated was even a possibility." It is a possibility. Your body has the mechanism. Tonight is when you activate it. Leave a comment telling me your starting fasting glucose number. Come back in 7 nights and tell me where it ended. Your numbers help other people in this community understand what to expect and give them the confidence to begin. If this video gave you something useful, share it with someone who has been managing diabetes for years and watching their numbers slowly worsen despite taking their medications faithfully. They deserve to understand the difference between controlling glucose and eliminating it. Subscribe if you haven't already. I'm Dr. Jake Taylor. Take care of yourself, and I'll see you in the next video.